With us today is Dr. Farah Sharani. She is an oncologist at Driscoll Children's Cancer and Blood Disorder Center. Thank you so much for joining us today.
Happy to be here. Thanks for having me.
Well, as we begin to help raise awareness, we want to talk about what cancers are the most common among children and if anything can be done to even prevent this.
Sure. I'll start by just talking about how common pediatric cancer is at all. So every day in the United States, we have about 43 children that are diagnosed with cancer. And 1 in 8 kids actually succumb to the illness and do not survive. So pediatric cancer remains the #1 cause of death for children here in the United States.
Now, for this to be such a common thing, which I had no idea that it was this common, is there anything that can be done to prevent childhood cancer at all?
Unfortunately, not that we know of so far. And we've done a lot of work to look at risk factors and to look at if there's any environmental things. You know, there's always a talk about plastic in the microwave or other chemicals that we've been using, but there have been no established links to date that we know of that affect kids with cancer, but we haven't stopped looking. We're still looking at that.
Now, with that said, with research happening and many of us donating to great causes to further the research and eventually, hopefully, find a cure for cancer, are there any advances that are worth discussing right now to help fight childhood cancer?
Absolutely. I think we've seen a big change in pediatric cancer over the last 50 years. Only 4% of national funding actually goes to pediatric cancer research, which is a very, very, very tiny chunk, but it's because compared to the incidence of pediatric cancer compared to adult diseases. And most recently, we've actually started implementing some immunotherapy in pediatric cancer. This is a very cool concept where we train and help the patient's own immune system recognize the cancer cells and kill it itself. And so it's a completely different new way to attack the tumor cell, and it's really enhanced the cure rate for a lot of cancers in kids.
Well, that is fantastic news, and I'm sure you're putting a smile on some of the faces at home that are watching, because it is common and it is something that many parents unfortunately have to face, and no one wants to have to think about losing their child, especially to something like childhood cancer. Now, what are the best ways for us as a community to support? You mentioned only 4% goes particularly to childhood cancer studies. Are there certain programs or ways that we can donate to ensure that our money goes to this particular area?
Of course, I think that's a really great question. Driscoll does several childhood cancer awareness events every year. Unfortunately, with the pandemic and COVID going on, we've been very restricted in what we can do to raise awareness on this behalf. The elections are coming up next month, and I think that this is something that you need to think about when you go out and you vote. And this is a great way to advocate for what our community needs. And I think research into cancer therapies, whether it's for adults or kids and medical research is a very important thing to keep in mind when you go out and advocate for that, whether it's at the local or at the federal level. But there's little things that you can do in your community. These families are right here, living right next door to us. And, something as simple as updating your profile picture with the Go Gold Pediatric Cancer Awareness banner, your status really raises the awareness and makes you more welcoming, so that these families can feel accepted and be able to communicate and kind of be an outlet for them.
And before we go, I'm not sure if I know every circumstance is different, but for anyone out there who may have just discovered that their child has been diagnosed with cancer, or has a family member or friend, maybe just a Facebook friend, as you mentioned, someone they're not close with, what advice do you have for them to be supportive towards that person?
I think out there in the community, it's still really a trigger word, this C word, or cancer, or chemotherapy. A lot of times, all these families want is somebody to say, you know what, I know you're having a hard time. I don't know everything. If you want to talk to me and kind of help me understand, I'm here, I'm available. It doesn't have to be today, call me 3 months from now in the middle of the night, whatever it is. And just to kind of let them know that you are there, and it may be hard to touch base with them all the time because they are for a very busy treatment schedule, but just to make them know that you're available, I think can be very helpful.
Wonderful advice. And being there and being supportive to somebody doesn't cost a dime. And sometimes that can be the most impactful support that you're able to provide. So Dr. Sharani, again, thank you so much for taking the time aside to discuss this topic with us. It's so important, and you have done your part for today in helping raise awareness, and we hope that we can continue to do so not only for the month of September, but all year long, so that eventually we can find a cure.
It's my pleasure. Thank you for having me.